नाज़रीन, आपने रिपोर्ट देखी। इस वक्त मेरे साथ मौजूद हैं डॉक्टर जेनेट ग्रांट, जो कि यूनाइटेड किंगडम से ताल्लुक़ रखती हैं। वहाँ से यहाँ पर तशरीफ़ लाई हैं इस कॉन्फ्रेंस के हवाले से। शी इज़ अ प्रोफेसर ऑफ मेडिकल एजुकेशन और उनका ताल्लुक़ यूनाइटेड किंगडम में डिस्टेंट लर्निंग प्रोग्राम से है। आइए उनसे बात करते हैं। हाय जेनेट, हाउ आर यू?
I am very well and very excited about what I've been hearing here.
What is it like to be here in Pakistan?
I really like being here in Pakistan. I've been here on a number of occasions. It's very vibrant. The medical education community is very creative, is developing very quickly, so it's very nice. And being here in Islamabad is so beautiful. And the food's nice.
That's nice. Janet, what would you like to say about medical education?
What do you want to know about medical education?
All of it.
Do you want to know what it is, how it works, what sorts of things people are thinking about? Medical education. When I first came into medical education, that was about 40 years ago, I didn't even know what the term meant, and so most people probably won't. Medical education is concerned with how we train medical students, and then how we train specialist doctors, and then how doctors who are in practice keep themselves up to date. So there are 3 stages: the training of a student, the training of a specialist, and then a doctor who keeps up to date. And medical education looks at how we do that best. Well, it also looks at the problems, obviously.
So at the end of the day, it's the common man who gains the benefit as we produce better doctors.
Well, I would hope so, and I would hope that the common man who gains the benefit is here in Pakistan and not abroad.
Sure. Janet, what would you like to say about the intellectual capacity of Pakistani doctors?
My experience of Pakistani doctors is obviously very limited.
Sure.
I meet doctors who are interested in medical education, who I have to say are as thoughtful and as creative and as analytical as any other doctor anywhere else in the world. Doctors in practice, I do meet quite a lot in my own country, in the United Kingdom.
Who are from Pakistan?
Who are from Pakistan, yes.
Okay.
In the United Kingdom, whatever we think about medical migration, and I hope that improving medical education here does not improve the chances of doctors going abroad. But our health service in the United Kingdom has benefited hugely from Pakistani doctors coming and practicing and training in our healthcare service. And in our country, we have always been extremely impressed with doctors from this entire subcontinent. And strangely enough, impressed with their training. In particular, the doctors from this country have a huge knowledge base, especially in the science that underpins medicine. And we are very, very impressed with that. And I've been when I've been here and at this conference, I've been extremely pleased to know that the value that is put on the scientific knowledge that every doctor must have in order to practice is not going to be downgraded, but is still highly valued. So I would say that my opinion of doctors from Pakistan, as far as I have sampled them, has always been an extremely good opinion.
Would you like to say something about AEME?
Yeah. Yes, the Association for Excellence in Medical Education is a relatively new organisation in Pakistan. I think it's an extremely significant one. I have to say that it is led by some very, very far-sighted people who are also extremely dedicated and very, very knowledgeable. I think it's really important because it brings together all of the issues that this country is now starting to think so seriously about in how you train your doctors. So the Pakistan Medical and Dental Council has developed tremendously in setting standards for training, setting standards for practice, in making sure that medical schools, and this will have to be all medical schools, whether public or private, actually reach the right standards. And the Association for Excellence in Medical Education is related to that, because if you are going to set standards and look at the quality of training and of practice, you also need an organisation which supports people to improve and which does the research and the analysis of what is needed. So the relationship between the Pakistan Medical Council and the Association for Excellence in Medical Education is a very important one. And the other thing that's important about the association is that it is a national thing, and that it will encompass people and enable people from different medical schools to talk to one another and to benefit. And at the meeting that we're at the moment, it is also obviously international. There are people here from other countries who come to learn and to listen and to exchange. So I think it's an extremely significant development that, as you say, in the end will benefit the delivery of healthcare in this country. Sure. Yeah.
Janet, do you think such conferences should be held on repeated intervals so that people from different regions of the world can come together and share their experiences, their researches, so that betterment can be promoted?
That is a really interesting question, and the answer to it is very difficult. There are international conferences of medical education. There are international organisations such as the World Federation for Medical Education, which I belong to, and we set global standards for medical education, which people then use and version locally. So there are already international meetings, international processes, international training courses. It's obviously very good for people to talk to one another from other countries. But there are also problems, I think. You know, at the moment people talk about the global doctor and globalization of medical education. What that actually means, and I'm from the West, what that actually means is that ideas from the West flood to other places. And it actually means then that doctors from other countries can go more easily to the West, or we can take them. So it's not an exchange. Now, if we could find a way of countries talking to one another and sharing ideas and so on an equal basis,
that would be much better.
Not so that your country would listen to America or to my country, the United Kingdom, but also so that we listen to you. And I've been saying this, that we listen to you, because there are things going on here that are an example to us as well. Then yes, of course, international exchange is good. But international exchange is only good if it is exchange, if it's partnership, if it's not the West dominating. And that is the danger. The West dominates in ideology in this area. So there is no easy answer to your question.
Janet, to bring about a change, it implies quite a big responsibility, especially a change that will affect in future the life of every man.
Yeah.
So, as far as modifying medical education is concerned, should we also keep our needs or requirements in vision while doing any sort of modifications?
When you change medical education, as you quite rightly say, you are either enhancing or you are threatening the nature of the doctor who will eventually be produced. I just made the point actually in this conference that when doctors do research involving patients, or they introduce a new treatment or something, they have to go to an ethics committee. They have to get ethical permission to change what they do as a doctor with patients, so that you can't experiment with a patient. It's not possible. When people change education, and as you point out, that does actually then have an impact on the care that people will get, nobody has to go to an ethical committee. They can just change education. They can just change what happens. They can change the curriculum. They can change the teaching methods. Nobody has to go to an ethical committee. And I think that there is a need, before people make big changes, there is a need for people to think very carefully, and perhaps to have an educational ethical committee. And that relates very much to these issues that you're raising about what you need here, because some of the things that happen is that ideas are imported from the West, very often ideas that don't even work in the West actually. They're imported here, they're used, they might or might not work, and it isn't just here, it's a lot of other countries, without doing the correct form of analysis about what is needed here. I think people think that excellence is about what comes from Western countries. It isn't. You can have excellence, and I've seen it here with people who've given papers here this afternoon, which have been fantastic, about things that they're doing. And you need to make sure that what you do fits in with your culture, your circumstances, the amount of facilities that you've got and so on. And you can provide excellent training within your context according to the needs of the communities and the needs of the healthcare service. And so I think that change has to be very much on the basis of an ethical reflection about the effect of this, and absolutely rooted in what your country is and what your country needs and what the strategy is. Absolutely. Otherwise, why would you do it otherwise?
Janet, you had an interaction over here within the conference with Pakistani doctors. You had some glimpses of the medical education system that is being followed here. Would you like to comment on that, or do you think how can we make it much better than it is?
I don't think I have a right to comment. I'm a foreigner. I'm from the West. I know what should happen in my country. I don't know what should happen in yours. All I can say is that there are things about your country that we admire, and I've said already, one of them is about the way in which you have a training in the science of medicine. We admire that. I've seen also the developments that are occurring. I've seen the way in which people are introducing new ideas, sometimes slowly, and that's good. I think, so I don't know what should happen, and I would never say. All I would say is that you should be cautious, that you should do what you need that's right for you. I think that maybe if I were forced to comment, the only thing that I would probably say is that any country and every country strives to have equality of excellence across all of its medical schools. Nobody should be in a country where they feel the need to ask what medical school their doctor went to before they feel confident in them. You should know that if a doctor is trained in this country anywhere, that doctor is going to be a good practitioner. And so I think this country, as many other countries, possibly including my own, actually does have the challenge of making sure that all medical schools...
So intellectual equality should be promoted.
Of course.
Janet, it was a pleasure talking to you.
Thank you very much indeed. Thank you.
नाज़रीन, प्रोग्राम के अख्ताम में जो बात मैं आपसे करना चाहूँगा वो ये है कि हमें ज़रूरत है कि इस तरह के इवेंट्स हों जहाँ पर मुख्तलिफ़ लोग मुख्तलिफ़ इलाक़ों से या दुनिया के मुख्तलिफ़ ख़ित्तों से आकर इकट्ठा हों, जहाँ पर वो अपने एक्सपीरियंसेस को शेयर करें, जहाँ पर बात की जा सके बेहतरी की ग्लोबल लेवल पर। मैं उम्मीद ये भी करता हूँ कि पाकिस्तान में मज़ीद बेहतरी आए, मेडिकल एजुकेशन में जो मॉडिफिकेशंस होती हैं वो हमारे मुस्तक़बिल के डॉक्टर्स को काबिलियत के मयार में हमसे मज़ीद बेहतर बनाएं। इन्हीं अल्फाज के साथ मैं डॉक्टर इकराम आपसे इजाज़त चाहता हूँ। अपना ख्याल रखिए। अल्लाह हाफ़िज़।